My name is Brett Hampton. I'm a licensed clinical social worker, and I work at a facility called Rehabilitative Health Services, or RHS as we're known here in Southeast Idaho. And I have been in the field for, this will be my 18th year, somewhere around there. And I started social work in the developmental disabilities field, did traumatic brain injury, social rehabilitation, and then went to the old school PSR. If a lot of you remember that, that's now CBRS services. And throughout the treatment there, I decided I wanted to do mental health counseling, and went to Eastern Washington University, got my master's degree there, and came back to East Idaho, and I've been here ever since. I've got a family. I have 5 boys and 1 girl. I've been married. It'll be 20 years in January, and just love coaching. I'm addicted to golf, and just love what I'm doing. Kind of a fun story that happened this weekend. Me and my business partners, we went to a Chargers game, and we were sitting in our seats, and I look down and I see this person, and I'm like, I swear I know her from somewhere. I swear I know her from somewhere. And the more I kind of started thinking and looking, I was like, oh my goodness, that's my client that I haven't seen since she was like 20 years old. And so I went up and just said, oh my gosh, I haven't seen you forever. And she's like, oh, Brad, how you doing? And it's been probably 14 years since I worked with her. And it was just a really neat experience for me to be able to see like why we do what we do. And to hear her tell me her story of she's married, she has 4 kids, she's doing well. The treatment that she received was so helpful and impactful to her life. And I just kind of like walked away just feeling like, okay, that's why I do social work. That's why I'm in the field that I'm in, is to help people. And and I think that, I don't know, it sounds like there's a lot of we have a lot of doctors and psychologists and social workers and nurses on this call. And a lot of times we run into clients that don't want to change. And sometimes we run into clients that are just excited, to ready and willing to change. And it kind of leads into a little bit for me is DBT, or dialectical behavioral therapy. What we're going to be kind of looking at here is looking at the theory, the rationale, and the history of DBT. I promise I won't bore you and go into all the like details and the history of everything. But you could Google Marsha Linehan DBT. There's a nice 45-minute deal that she does, talking about a little more in depth of how DBT became. The other thing too is we're going to kind of learn about the structure and the format and delivery of DBT, and remembering that I am coming from an outpatient setting. And so it sounds like there might be some people viewing that are in inpatient treatment, maybe partial hospitalizations, things like that. That'd be able to give some good insight too, is maybe it's a question answer pieces at the end. And then we're going to be going over the DBT skills. So this isn't going to be like a group therapy session or an individual session, but I'm hoping that some of you will participate in a few, and invite you to participate in a few of the skills that I'll be teaching you, and what maybe some of your clients are currently receiving in treatment, if they're getting dialectical behavioral therapy, or if our prescribers and things that are looking for a type of therapy that could be helpful for individuals with borderline personality and other diagnoses. And I'll go into that a little bit more in depth. So, but we'll be looking at the mindfulness, the distress tolerance, emotional regulation, and interpersonal effectiveness skills. So a brief history. DBT was developed by Dr. Marsha Linehan in 1980s. And her story is really, it's fun listening to her tell her story. But some of the pieces that kind of a good summary, at least that I understand, is she was trained in cognitive behavioral therapy, and then was hired on at a hospital, and started doing counseling. And she noticed that, like, the typical behavioral therapy was helpful. At the same time, they ended up receiving a grant, a small grant, and they needed to work with these individuals in an inpatient setting that have what she calls quote unquote difficult clients. She wanted all the difficult clients, right? and so she got her wish. A lot of people were referring, and she was doing research as well with individuals with suicidal ideations, self-harm behaviors. And as she started in doing the therapy, she noticed that a lot of these clients were struggling with emotional regulation, lots of trauma, and didn't really know how to just kind of be mindful and kind of focus in. And so that's kind of how DBT was developed and formed. And so when we look at the balance of CBT, or cognitive behavioral therapy, with DBT, it brings in a couple of pieces. One of those is her work with treating individuals with borderline personality disorder. And honestly, DBT is kind of coined with treating borderline personality disorder, but it's also very effective with other different diagnoses that we'll get into a little bit. So this book here is one that is very insightful, and then the DBT skills training manual is another one that I've used over the years, and a lot of I'm assuming a lot of therapists have as well. When I teach DBT skills, I simplify things because there's so much going on in a person's life, that what I've noticed is when you simplify things and not make things so complicated, and it seems to help them a lot more. That's what I like about DBT. It's very systematic and it's very skill-based. So some of the treatment modes: individual therapy and group skills training. Also, you got coaching in a crisis, and then DBT skills. And then treatment priorities. This is where we're going to look at like different diagnoses and things. But substance use disorders. In our substance use program here, we use DBT paired with trauma treatment as well. Suicidal behaviors, self-harm, or life interfering situations as well. And then you have depression, anxiety, and then also eating disorders. And so the thing too, I've noticed that the DBT skills have really helped a lot of people with anxiety and depression as well. Even teenagers, young adolescents with ADHD. So one of my favorite parts, let me see if I can minimize this real quick because it's right in my slide. Okay, one of my favorite parts about DBT is it makes these positive assumptions, and some of these assumptions are people are doing the best they can, and people also want to improve. Now, for those that have worked with individuals with borderline personality, it can be a roller coaster. It can be very difficult. One of the most difficult things that I see in my practice is when you give a skill and they say, "Oh, that's not going to work. That's not going to work. That's not going to work. I've already tried that," right? But if we take the assumption that people are doing the best that they can and they want to improve, then we want to really instill that strength. People need to try harder. We need to do better. We need to be more motivated. People may not have a cause of all their problems, but they need to solve them. They need to be in an acceptance and a change attitude of solving. And then new behaviors can be learned in all relevant situations, contexts, those types of things, that we can learn new things. And then all behaviors are caused. Changing the cause of behavior is more effective than judging the behavior. And then changing a life worth living. And I kind of go back to that that quick story of the individual that I worked with, just seeing her life where it was 14 years ago to now, just lots of positive changes. And I'm sure a lot of you have had those experiences as well. Those are kind of like those paydays. So who does it help? We talked about borderline personality. One here is post-traumatic stress disorder. A lot of people probably say like, that's not really going to work very well. What I've seen is what I like to do is do like more of the EMDR type of trauma therapy. And once we've processed some of those traumas, I'll incorporate some like emotional regulation skills, or incorporate distress tolerance, and I'll just kind of show you what those look like here in the next few slides. But also depression, ADHD is one as well that I've, and then the high irritability or explosive emotions. I don't even know what that diagnosis would be, but let's be honest. When something doesn't go well at work, or something doesn't go well within our marriage or our family or kids, we can get explosive, right? And we all share our emotions in different ways. And so that's something that really seems to be effective, is monitoring those emotions. So dialectical behavioral therapy, it's a skilled-based therapy, which we focus on emotional regulation, mindfulness, and interpersonal skills. It's evidence-based, it's holistic, and it enhances self-awareness. Self-awareness is a really, really important part to anybody getting better. Healing is they have to be self-aware. And then I've already listed some of those diagnoses or conditions that treat DBT treats. So the focus of DBT is this balance of acceptance and change. And this is kind of one of the most pivotal points in DBT. And the goal is there, as you can read, is to change the behaviors causing suffering in our lives while accepting ourselves and circumstances in the moment. This is extremely difficult to do. This is not an easy process. And a lot of times when we're asking people to change or accepting certain parts of their life, it creates a lot of resistance. It creates a lot of fear and struggles that way. And so, but if you take those assumptions, a lot of the times it's going to improve, because what I like to do is I like to instill those strengths and know that, hey, you know what, are you willing to change? What does that look like for you? And how can I help you with that change? And so DBT takes the cognitive behavioral therapy and Zen practices or mindfulness skills or practices. And then with the dialectics, which we're go into a little bit more of what does it really mean, dialectic or dialectical. So dialectical, this real quick. So dialectic means the existence of opposites. And in DBT, we're taught two seemingly opposite strategies, which one is acceptance and one is change. Okay. And acceptance is that your experience or your behaviors are valid But then at the same time, what are you willing to change, or what can change? And the way I like to describe this is, and I like to coach. I coach flag football. I've been coaching for 10 years, and I always, whenever I teach kids how to catch the football, I'll always kind of say, like, kind of put like a diamond up here like this, right? And these are first, sorry, kindergartners to, sixth grade. So it's not like, I'm not like an intense, coach or anything, but, and I probably, hopefully I'm teaching them the right things, but you kind of put your hand out here like this, where your hands are open, your fingers are open, you're making kind of this pattern here where you can receive the ball. Okay, that would be a willing person. And a willful person is somebody with their hands closed like this, and when the ball comes, it just ricochets off your hands. And so I always like to incorporate that when I talk about acceptance and change. Are you the type of person right now in your life? Are you willing to receive what's being given you, or are you kind of more on the kind of the willful position? And so that takes time for people to be ready to accept and to change. Well, what I found is a lot of times if I'm open and honest with them, then they seem to get that concept quicker, and change happens faster. So let's see. So I want you to I'm just going to invite you to do a quick little, I want you to just kind of look at this next image. Okay. And I know everybody's muted. And if we were in a group, I'd have you throw out what you see, but in your mind, just kind of tell me what you see. Now, this is an optical illusion, right? We're talking about dialectics, or we're talking about opposites of things. Some of you see faces, some of you see a vase. And when I say, do you see the faces? You're like, oh yeah, there they are. Do you see the vase? Oh yeah, there's the vase. Okay. So everybody's perspective of how they view life, how they view themselves is different. Okay. And so we want to help the individual be able to have a more positive perspective of who they are, and honestly, that other people see the world differently than you. And that just seems really frustrating for us. Why don't they just understand me, right? People with borderline personality disorder have a lot of issues with interpersonal relationships, a lot of intimate relationships, because there's a constant fear of abandonment, or how they perceive things. So with this, we're looking at some of the philosophy of dialectics. Okay, there is more, and this is something to really think about too. Well, before I even read these, or you start reading them, I want you to think of a situation maybe at work that's kind of got you a little frustrated of late, or a situation at home, or with your spouse or loved one or somebody. Okay, that is there a chance that there is more than one way to solve or see a solution? Moving away from black and white thinking, is that even possible? Is it possible that different opinions can be valid? Okay, two things that seem or are opposite can or could be true. Dr. Linehan talks about, if we can find the quote unquote kernel of truth, and looking at different sides, right? So looking at the different side of the coin, or, what do you see? Two faces or a vase, or, but if you can find that kernel of truth, then let's work with that one. Okay. And then this is saying something like, this is really hard for me, and I'm going to keep trying, versus this is really hard for me and I just can't do it. It's the art of holding two or more things in balance. of looking at the philosophy here. So, and this is a challenge that I have for all of you, is to really think about this, because you won't. A lot of people don't see how they talk to themselves or how they talk to others. But here are some statements that you can kind of see the dialectics happening. So the first one, this is really hard for me, but I'm going to keep trying. Okay, that's the one you just saw. Well, I can see it this way, and you can see it that way. Or sometimes I'm treated fairly, and at other times I'm treated unfairly. So a lot of people will use the word but. Okay. And what happens is when you when you use the word but, it invalidates what's being said. Okay. And if it a lot of times, and when they say but, it's usually also it's invalidating, but it's also in a sense kind of denial a little bit. Okay. A lot of what I hear is, sometimes I'm treated unfairly, but they're the ones that did it. But they're the ones, but work is just hard, right? But nobody will listen to me. And so that actually increases the emotion that people are struggling with. And so you can put that somewhere for yourselves of saying, okay, how can I incorporate not saying but in statements that I say? Okay. So taking a hold of your mind, and we're going to jump into this in a lot more depth, but one of the main concepts of DBT is talking about the rational mind, emotional mind, and the wise mind. And we're also looking at the 4 areas of acceptance and change, or the skill sets, is mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness. So when somebody says, or when you're done with this this Zoom meeting or its presentation, and somebody says, "What's DBT?" Okay, what's DBT? Well, it's dialectical behavioral therapy. There's a bunch of stuff this guy said, and it was kind of boring, but I was eating my lunch, I was getting a CEU, and cool, this is great, right? But for those that are really kind of going, okay, if I could explain this to somebody, DBT is a therapy that incorporates mindfulness, cognition, and skills. And these are the 4 areas: is mindfulness, emotional regulation, interpersonal effectiveness, and distress tolerance. So what I'm going to do is I'm going to kind of break these down into, like, what are the mindfulness skills? What do those look like? Emotional regulation skills, what do those look like? And so on. And this is one of the biggest things that Dr. Linehan noticed, was emotional regulation. That was a big part. So mindfulness skills. Let's look at, I don't want to read all this. So I'll just read this mindfulness part here. The quality of awareness that what a person brings to activities. Okay, being effective or controlling attention and taking a non-judgmental stance. And then letting things go or pushing it away. And I've got a quick story with increasing self-awareness. I have a 16-year-old client that I've worked with for now 5 sessions, came into my office, was sharing things on Snapchat and internet, inappropriate things. She's overwhelmed, lots of anger, a lot of resentment towards parents, and just overwhelmed with life, and started using substances, and then also sharing things, inappropriate things to these guys. And when she sat down, she was very very shameful, and had a lot of guilt and shame, and And I told her, I said, you know what? You really want to do good. I can tell you really want to do good. And I asked her the question of what what do you think are some of the things that cause you to react certain ways? And she couldn't answer that question. And so through DBT, we're talking about how, well, we'll go into the opposites and stuff, but basically helped her understand what she's feeling, not just in her thoughts, but what she's feeling with her emotions as well, and kind of bringing those two pieces together. And she started to become more aware that when A happens, then this is what I feel. And when I feel a certain way, then I act a certain way. And she came back the next session and said, you know what? I am more confident in myself. And I realized that when this person said this, I knew where that emotion was coming from, and I knew what was happening in the disturbance in my body, right? When my chest started getting really, really tight and I started to kind of shake, I knew what was happening. So she became more self-aware of her body, not necessarily the situation, but what was going on with her body. And that has changed the way that she is reacting. And that's a big piece that traditional talk therapy doesn't really identify is the what's going on with the body and being self-aware of that. So so here are the mindfulness, and I those that want to, you have a piece of paper in front of you. I want you to draw. Hey, there I am. Okay. So those that want to participate, I want you to just draw a scale like that on your piece of paper. All right. So 0 to 100. Okay. And you've got 0 is calm and 100 is let's call it Hulk, or yeah, let's just call it Hulk. So with the kids I work with, I usually do like a scale like this. With the older kids, I usually do kind of more of like a temperature scale, and I'll have them draw out, 0 to 100. And the mindfulness piece is when we look at this from 0 to 50, let's say that's our like rational mind. Okay. And 50 to 100 is more of the emotional mind. And I'll say, like, we don't make decisions up here. We make decisions down here. Okay. And you can also use this just with yourself individually is, where am I at right now? Okay. Am I kind of below this line or above this line? And on that emotional scale, that visualization seems to help people a lot to be able to know like where they're at on the scale. And DBT is very, very focused on skill sets. And one of those is the mindfulness what skills, okay? And it's kind of a practice that takes effort, okay? And one of the big pieces to this is, what are you observing within yourself? Describe using words and participate fully. So what that kind of looks like is, so for example, like right now, if you just like took a deep breath in through your nose, and then hold for a second and then let out. Okay, I tell people 4 or 5 deep breaths like that. And then just ask yourself, what do you notice? Okay, what do you notice? What do you see? What do you smell? And simply just notice. And then after 5 or 6 deep breaths, then describe, what do you put into your words, what you're noticing or what you're feeling. a lot of times people, and I just have some notes here that these are from what clients have told me, is like tightness in chest, maybe my stomach's a little uneasy. And one thing that I do is I make sure that they don't use words like good, bad, right, wrong. That there's nothing that they're doing good, bad, right, or wrong, but it's what are you just noticing? And then participating fully, are your hands out ready to receive? So that's the what skills. And again, like this could be, honestly, this could be a 3-day training, right? We could spend an hour on the what skills and you know what those look like. The how skills, okay, is more taking the judgments away. So staying away from calling yourself names or calling other people out. I don't know if you know, I have a bunch of kids at home, and a lot of times they'll be like, "Oh, this is disgusting. I hate spinach," you know, and then I'll say something like, "Well, what do you prefer?" Instead of saying you hate spinach, you know, say something like spinach is disgusting, or instead of saying spinach is disgusting, say something like I don't like spinach, I prefer broccoli, or you know, just a very simple change in how you judge things, how you judge yourself, how you judge people, how you judge food, how you judge the crappy drivers in Idaho, specifically in Jefferson County. And anyways, so I have thought about changing my license plate, but anyways, so looking at the non-judgmental and then being one mindfully, taking one thing at a time. This is a difficult piece for all of us. We are distracted by everything. Okay. I think one of the Echo Idaho presenters said, "I got the day off, self-care day. This is going to be great." Right. We got to take that time and be mindful. And then effective change, do what works, follow rules, and stay away from getting into this balance of things are unfair and life is wrong. So the dialectics is the balancing of opposites. Okay, keeping that change and acceptance and balancing those. So interpersonal effectiveness skills, and I'm going to go over a few of these, but interpersonal effectiveness is how do we deal with relationships in chaos. Okay. Question that you always want to assess is, well, tell me about your romantic relationships. Tell me about your current marriage, or tell me about your, you know, your history in relationships. And if it's a constant up and down, up and down, up and down, there's probably some interpersonal effectiveness struggles and knowing how to regulate emotions during those. One of the biggest things with, and probably the presenter talked about last week, is fear of abandonment. Fear of abandonment is real for individuals with borderline personality disorder. And the other thing too is regulating emotions when asking or setting limits. Okay. So this is a skill called Dear Man, and this is a skill that you can, I guess the biggest goal of this skill is, you know, what do you want? What is it that you desire? And I'll talk to clients too. I'll say, oh, I don't know. Every once in a while, there's things that we want, but what is it that you really desire? Okay. And you're describing the situation. I work with individuals that need to talk to a probation officer or talk to a boss, or, you know, lots and lots of times with my adolescents that I see, I want a phone and my parents won't give me one. I want a phone. And I'll go through Dear Man with them. Okay, describe the situation, express what you're feeling, ask for what you want, okay, or what you desire, explain the positives. But the thing is, the part that they don't like, and a lot of people don't like, is there's negotiation. Sometimes it's a no. So what do I do in that situation? And so being mindful, appearing confident, and this is one of the, when I talk about like I statements, this is something that I really like to use. I have these like cards, if you can see those, but the I message is I feel, I want, I feel, and then when, because I want. That's something that's really a good skill for a lot of us to use, especially if you have kids that are having big behaviors. You can help with the regulation and then introduce this to them. That can be very helpful because it helps them be able to kind of activate more of the cognition piece. So another one is think. Okay. And because of time, I'm going to go into a couple. I'm going to skip this one. But these are all things that you can look up. Google like DBT, interpersonal effectiveness skill, think, and it'll pull up. I'm going to go into this opposite. Okay, so emotional regulation. When we talk about the mindfulness, those 4 areas, interpersonal effectiveness, emotional regulation, and distress tolerance. Choosing opposite action. So when you look at that, kind of like, what's the initial emotion? What's happening? Oh, I'm angry, I'm sad, I'm frustrated, I'm bored out of my mind by this presentation. What do I do? So what's my urge? My urge is to run away, right? Or let's look at sadness. I isolate, I cry, I stay in bed. So what's the opposite of the urge? Connect, laugh, get up, and get out. What's the opposite of sadness, engagement, and happy? Now, this isn't like brain science, okay? But when somebody's in a distressful situation, when you bring in an acting opposite, there's kind of like the light bulb goes on and goes, oh, okay, so I can be happy and I can be peaceful, or I can engage, right? And so this one's really effective. This acting opposite can be effective. So it's a very good skill with emotional regulation. Another one as I like to do is a lot of people can't put words to certain emotions. They may say like, I'm just mad. And this emotion will, you can get this image, just Google emotion will. But I don't know if you can see my cursor, but if they're like, I'm just really mad. Okay, well, you take mad and then you go outward where you have words to that emotion. Hurt or hostile or angry or selfish or hateful or critical. Okay, and then just kind of branching out that way. That's another really good visual for people to look at as well. So these are some of the distress tolerance skills. And I'm going to go over TIP, that first one, the TIPP. So this one I use a lot with individuals that get very upset and angry. When you look at that scale, when you wrote down that 0 to 100, this is an individual that goes from 0 to 100 within like 5 seconds, maybe 2, maybe 30 seconds, and they turn in, it's like Bruce Banner to Hulk, super fast. Okay. And you've all been around them. It's either you or your coworker or somebody else that you've been around. It's like, my goodness, when I just said this, about ripped my head off, right? So what's happening is the body is dysregulated. Okay, it's in a fight or flight response. And so TIP is a really good skill. The first T is temperature. So you're changing the temperature of your body. Okay. And what I like to do is you can get like little ice, just either these little ice packs. Okay. And I tell clients to put them right here on their wrist or hold an ice cube in their hand, or just put, the ice cube, seriously, or not the cubes, but the ice packs right on their face like this. Okay. What that does is it's going to regulate that temperature and kind of cool you down. And it also distracts the mind. I have a client that I'm working with right now, 24-year-old female, had sexual abuse trauma, lots of stuff going on. And she's like, I am so mean to the people I love. What is going on with me? Right. And she's been using the TIP skill. and it's been helping her a lot. She takes 5 minutes, goes and gets an ice cube, right, and just holds it, and it distracts her mind and allows her to start breathing. The next is I, which is intense exercise. So going for a quick walk, doing some push-ups, sit-ups, obviously depending on their, their physical abilities and stuff like that. And then P is pace breathing, taking a deep breath in for 4 seconds, holding it for, I like holding it for about 2 or 3 seconds and then just slowly letting out. So I usually like to do 4 seconds in, hold for a second or two, and then slowly let out. And I say do this for at least 30 seconds to 60 seconds. And then you got the muscle relaxation, or what I like to do is just like clench your fist, take a deep breath in, and then let out. Clench your fist, take a deep breath in, let it out. This is something that gives people confidence in themselves that, okay, I'm doing something, I'm learning something that I can do for me. And that's what I like about this therapy is it's I wouldn't say it's prescribed, but it's very skill based. The other thing too is it's important for us to realize that these are non-medication treatments for emotional regulation. Okay. And this takes practice. Now, so that's tip. The other one, distress tolerance skill, is accepts. So what this kind of looks like is if, let's say, I had a client last week came in and I've got to get my lawn mowed and I've got my fence broke and I have no money and it's getting cold and the winter's coming and I'm just overwhelmed with everything and my kids suck and they don't do anything. They're just lazy and just going off on all this stuff, right? And I always give my clients like 5 minutes to just emotionally throw up on me. And then I'll say this, and then I'll say, so what skill did you use? What do you mean, what skill did I use? Well, did you use tip skill? Did you use accepts? Did you use, I'm like, Brad, I hate those stupid skills. I don't want to do those skills. I said, okay, well, let's do tip right now. Right? And you have to take that approach with helping them see that you can take a medicine, but you can also take a skill as well. Okay. And so that tip skill is something, and accepts here, as you all can see on that on the slide, engaging in activity. Okay. Contributing, doing something for somebody else. Okay. Comparisons. Put your life into perspective. Ask yourself, am I safe? Okay. Is there someone who cares about me? Emotions. Act opposite of the emotions. If I'm anxious, practice meditation. If I'm sad, watch a funny video. Okay. Well, and I hear a lot of times people are like, well, I can't meditate. I'm just too anxious. Well, then get up and get your body in motion then. Get your body moving, and sends different signals to the brain as well. So, and then push the problem away temporarily. It's not denying it, but it's, hey, you know what? Put this in a container, and that's an EMDR skill, is container. Put it in a container, ship it on its way, and let's focus on something else right now. That can be helpful for people as well. And then the thoughts, replace the negative thoughts or the anxious thoughts with more positive cognitions. Oh, whoops, sorry. And then the sensations, the 5 senses or self-soothe. Okay, warm bath, light a candle, relaxing music, eat some comforting food. Obviously, everything in moderation, right? Can't just like, well, my therapist said, just gonna eat Cheetos and watch Netflix all day, like, because it's comforting. That's not what I'm saying, but sounds fun. So I'm gonna skip up because I've only got a couple of minutes, right, Shannon? We wanted to stop at in 10. Okay, so let's just look at this is another one. Distress tolerance is improve. It's the improve skill, kind of similar to the last one, but This is one that you can also use. And then this is one that I use quite a bit. And I was, to be honest with you, I was never until I got EMDR trained, I was never really bought into the whole visualization, deep breathing piece. And it's taken a lot of work for me to do it as well, because I'm the type of therapist that's going to be, if if I'm asking you to do hard things, I'm going to do hard things as well. And I also take the approach that I'm not going to work harder than you. So like we can work together, right? And this self-soothe, vision, hearing, smell, taste, and touch. Okay, I like to have people create an image for themselves. Mine is West Bay, Honduras, snorkeling. That's my place. Okay. What are you hearing around you? What do you smell? What do you taste? And what do you touch? Okay. And this is something that like I said, that's a lot of groups will have check-ins. Okay. They'll be like, hey, let's check in. Where's everybody at? Individual therapy, I always ask, what is new and different? Okay. What is new and different? There's this emotional throwing up, and then I'll say, all right, let's jump right in here. Let's take a deep breath in, deep breath out, right? And get regulated before we move forward. So these are, it's a lot of information. Most DBT trainings are 2 to 3 days. This is a very quick overview. And so let's open up to questions.
Thank you, Brett. We can go ahead and stop your share, and then we will open it up to the whole group and see what we've got for questions.
All right.
Hey, it's Tara Whitaker. Thank you so much. That was super helpful. I guess, and I feel like so many of these skills are just skills that all of us could benefit from. So it's wonderful to just think about it in general, because I see how it could apply to so many things. So I think that's wonderful. My question, I guess, is, again, I'm primary care. Visits are pretty short. I always think of DBT, and I think I've always visualized it as this thing that requires like intensive treatment for it to work. But when you're sharing some of these skills, I think bits and pieces could be helpful. So I guess, do you have any thoughts on that? Like, is it worth recommending a book without them being in a DBT counseling dedicated situation, or like just piecemeal talking about skills? Like, what are your thoughts on that?
Yes. Okay. Let me grab something real quick. Don't have it. What I have is like a little DBT flip chart.
Okay.
And if you're going to give a skill, make sure that they at least have, for example, I'll print off this Dear Man skill, and I'll give them a sheet, and then it has the worksheet to it. And you're right that in the prescribing, you got it, what, 20, 30 minutes. It's a real quick appointment. And so these skills can be helpful. I would do just a quick, like they have like DBT quick cards where it'd have that skill, like the tip skill, and you could just hand them that copy of that card, something like that. That's what I would do. The other thing is I would collaborate with the therapist as well. One thing that I like about our practice is that we have the kind of more of a comprehensive look. I can walk down the hall right now and go talk to the doc if I needed to, right? And I could say, hey, these are the skills we're working on, So does that answer your question?
Yeah, that's great. Thank you so much. And I think someone wrote in the chat that DBT skills are life skills. So I think it's so great for us all to be learning about it. That's awesome.
Yeah.
Thank you.
Absolutely.
Brett, we had a question in the chat from Amy Newsom, who said, do you do telehealth? Could somebody in the Moscow area access your services?
Yes, we do telehealth. And just as long as the connection's good, that's the worst part about telehealth, is if the connection's bad and you're like in the middle of something and you're breaking up, right? But we do provide telehealth services, yes.
That's great. We have a few more minutes if anybody has one or two more questions. And you are able to unmute yourselves, my audience members, if you would like to.
This is Tom Purdy.
Hi, Tom, go ahead.
Hi. Yeah, Brett, a couple of things, given your program here for DBT. When I use DBT skills with people, I try to be really specific. The question was, well, is there, I think Tara, you asked, is there something that I can give my patients? Be careful to not give them too much. So I like, even with the tip cards, I give them one at a time and ask them to use it and see, does that work? And if it works okay, we keep doing it. If they say, not so much, then we go to the next one, and then compare over time what one works the best for them. Because what I find is, all too often they get overwhelmed and they don't know what to try, and they're reading all this, so they give up reading it and they don't try any of it. And the other thing that I do is, it's hard to get people to practice. And Brett, you mentioned the practice part of this. And one of the things that I say to people over and over, DBT or not, whenever there's something that I think will help them, I want them to practice it when they're not escalated. When things are going well, that's when your brain's working on it and when it's learning from it. And then that's when you'll learn it best. Once it becomes a skill that is really almost innate, you become more easily quick to figure out that you're becoming escalated. The intervention happens sooner. You don't go up the ladder as farther, and it doesn't last as long.
Perfect. Yeah, that's perfectly said. Absolutely.
Got one last question for you, Brett, that was sent to me in the chat. How do you introduce DBT to a client who's highly resistant to change?
Yeah. So this is honestly, this is my take on it. My experience, people get change when there is a positive therapeutic relationship with the therapist. There has to be a trusting relationship with that therapist before they're even going to take anything that you have to say. Because let's be honest, a lot of these clients have already tried a bunch of stuff that they think is not helpful, right? And they'll use other words for that, but it's not helpful. I've already tried this, I've already tried that. And so I take a very real approach with my clients. And I'll just be honest, I'll just say, hey, you know what? Are you willing? Are your hands open to be able to catch some things that I'm going to throw at you? Can you give it a try? Right. And like what Tom was saying, man, I'll go through 4 or 5 skills and they're like, that's dumb, that didn't work. But man, the ice cube in my hand, that changed so much for me, which, you're not going to know that unless they try it. And so every client, if you take those DBT assumptions that everybody's wanting to improve, that'll help you as a therapist or a prescriber or a nurse to just see them in a different light, where they can kind of sense some of your, your positivity in helping them. Does that answer the question?
Yeah, I think that's great. Brett, thank you so much for a wonderful presentation today. It was really great to have you come in. And as many people said, these are just incredible life skills for everyone. So thank you so much. We hope that you will join us in 2 weeks on Wednesday, November 1st from noon to 1 p.m. Mountain Time. Our panelist, Rachel Root, who is a psychologist with Treasure Valley Psychology, is going to be presenting on perinatal mood and anxiety disorders. So this will actually be an introduction to our soon to come maternal mental health block that will happen starting in January. So we hope that you all join us in 2 weeks. And Brett, thank you so much. Have a great rest of your day, everyone.
Thank you. See ya.